This article reviews major pediatric chest wall deformities, including pectus excavatum, pectus carinatum, Poland and June syndromes, and sternal cleft. It outlines their clinical impact, diagnostic workup, and both conservative and surgical treatment options, emphasizing multidisciplinary care to improve long-term quality of life. Here, the focus is pectus excavatum. We examine suspected patients through history, inspection, imaging, and cardiopulmonary testing. Indices such as the Haller Index quantify severity. Treatment ranges from observation and vacuum bell therapy to surgical correction when symptoms, cosmetic concerns, or cardiopulmonary compromise are significant. This section details the Nuss and Ravitch procedures for pectus excavatum. Both aim to remodel the depressed sternum using bars or cartilage resection. We also discuss postoperative care and complications. The page then introduces pectus carinatum, highlighting its etiology, typical presentation, and need for individualized assessment. Management of pectus carinatum is primarily conservative, using dynamic compression braces during growth. Surgical options, including modified Ravitch and minimally invasive Abramson repair, are reserved for severe or refractory cases. The page then transitions to Poland syndrome, describing its defining absence of the pectoralis muscle. For Poland syndrome, diagnosis relies on clinical evaluation and imaging to map muscle and rib defects. Treatment is tailored to severity, combining thoracic reconstruction and soft tissue augmentation. June syndrome is then introduced as a thoracic dystrophy causing a narrow chest, with early recognition critical for respiratory management. This page explains surgical strategies for June syndrome that expand the rigid thorax, followed by an overview of sternal cleft. Prenatal imaging can detect this rare midline fusion defect. Early neonatal repair, often using grafts or prostheses, protects intrathoracic organs and improves respiratory function and cosmetic outcome. The closing sections summarize that chest wall deformities vary widely in severity and psychosocial impact. Optimal care requires individualized planning, combining conservative measures with advanced, minimally invasive surgery. The article is externally peer-reviewed, with no conflicts of interest or financial support reported.